type your questions into the chat or the Q&A. So, okay, here we go. So New Visions 2050, the long-range transportation plan for the Capital District, is a blueprint for regional transportation that reflects a shared vision for the future. It's a 30-year plan, and it guides the prioritization and funding of investment decisions in the capital region. It was developed collaboratively with transportation providers and stakeholders, local governments, state agencies, also the private sector, and of course the public. And I think you're all familiar with the Capital District Transportation Committee, or CDTC, but if you're not, we are a Metropolitan Planning Organization, or MPO, which is a transportation policy making and planning organization. We allocate federal transportation funding resources to local transportation projects. The MPO includes large state agencies and regional planning organizations like the Department of Transportation, the Capital District Regional Planning Commission, the CDTA, the Transit Agency, Albany International Airport, the Port of Albany, and the Thruway Authority. Representatives from all 4 counties participate at CDTC and are on our committees and boards, as well as representatives from our cities and a rotating number of representatives from the towns. So what is in the CDTC New Visions 2050 plan? There's a number of parts, and if you are only going to read one part, we encourage you to read the executive summary, which really condenses and summarizes the major points and principles and themes in the plan. However, there's also a system performance report that evaluates the performance of the regional transportation system, a public participation plan. There are 11 technical area papers from transit to bicycle and pedestrian to general mobility to freight. A range of topics are there, and they really take a deep dive and technical and a more technical approach to each of those topics and programs. There's a financial plan, and then of course a glossary of terms and abbreviations, because if you know, as planners, we love our abbreviations and terms. So transportation funding received at CDTC can be used to address a variety of needs. Transportation affects everyone. We need good roads and bridges to drive on, reliable buses to ride on, more sidewalks, trails, and bike lanes to walk or bike to access local amenities, and provide affordable transportation options for everyone. While some funding sources are restricted to specific types of projects, the majority of funding can be used on all of the types of projects in the topics shown here. And New Visions 2050 lays out principles for continuing to develop a multimodal system that acknowledges all the ways the transportation system impacts your daily life. Historically, there's been regional consensus for many of these strategies and principles, and we are continuing to do outreach in the region and make sure that we continue to have consensus and that the public supports these principles and strategies identified in this plan. The New Visions planning and investment principles are the centerpiece of the New Visions plan. They're directly related to criteria used by CDTC to evaluate proposed projects and prioritize them for federal funding. They were developed and proposed over time by our New Visions task forces, and these principles influence the types of tasks and initiatives CDTC initiates and supports, like our local road safety plan, Capital District Trails Plan, security planning, and the coordinated plan. One of the planning investment principles that we'll focus on today is providing essential mobility for all. So a quick snapshot of our region. We are a unique multinodal area that includes 8 cities and a number of unique towns and villages. We're connected by a series of highways and arterials, but also an economy. And the region is situated at the crossroads of two major interstates, I-90 and I-87, and two rivers, the Mohawk and Hudson. So there are diverse communities from vibrant urban centers to rural agricultural lands and villages, and they're all attractive destinations for visitors. We have a large number of social, cultural, and recreational opportunities. It's the home of a state capital and enjoys a stable economy, which is bolstered by a large state government workforce, a number of colleges and universities, and large medical institutions. Despite these advantages and consistent development, the region has experienced little growth population-wise, and its population is not projected to significantly increase. And while population is not growing at a significant rate, our needs are changing. We have an aging population, smaller families, less young drivers, and just changing expectations and lifestyles. So New Visions 2050 has several policies and best practices which are proposed for implementing the vision that's laid out in the plan. These include maintaining a state of good repair of our bridge and highway system, managing congestion instead of adding capacity, implementing complete streets, transit-oriented development or smart growth, access management, implementing safe systems or Vision Zero policies, Americans with Disability Act compliance, and expanding and improving our public participation. So if you're wondering what the impact of the long-range planning process has on the region, these are just a sample of some projects that have been and studies that have been implemented or are products of previous long-range plan. They include our bus rapid transit system, the Albany County Rail Trail, the recent study of the I-787 and Hudson River Corridor, Cows Corners roundabouts, the I-87 Exit 3 Airport Connector, the rehabilitation of the Rexford Bridge, the Madison Avenue Road Diet, continued paving of our interstates, and replacement of other bridges and extensions of trails and other projects. So looking forward, as we try and figure out how we will pay for the vision that's outlined in New Visions, we realize the reality is that transportation costs are increasing faster than available funding. Our multimodal approach prioritizes projects that address multiple needs. For example, a road diet or a project that reduces the number of lanes can improve safety for drivers, people crossing the street, and people bicycling on the street, but it can also move traffic more efficiently and reliably while improving the look and feel of a corridor, which can benefit businesses there. So these are the types of projects that we continue to help communities plan for, and we try to implement at CDTC. So implementation of the plan, as said earlier, the New Visions 2050 planning investment principles and major strategies influence our other major MPO products, including our Unified Planning Work Program, or UPWP. This is a list of all of the tasks and initiatives that CDTC undertakes on a daily basis. And the Transportation Improvement Program, or TIP, which is the 5-year capital program. New Visions 2050 influences both of these, and this is how we implement this plan. Moving forward, CDTC has developed and is rolling and has been hosting a virtual learning series on New Visions. Since we can't do in-person public outreach and events right now, we are scheduling webinars on a monthly basis on a range of topics and subjects related to New Visions. The next webinar is scheduled for March 16th and will be on regional traffic safety trends. Also, if you're interested in introducing your planning board, zoning board, town board, or city council to the New Visions 2050 plan, we can deliver virtual training by request. We can tailor the presentation to your needs. If your board is interested in complete streets, we can talk about implementing complete streets. What does New Vision say about complete streets? If they're more interested in generally integrating land use and transportation, we can talk about that and talk about all of the resources and technical assistance available at CDTC to your community. For more information on New Visions 2050, you can go to cdtcmpo.org/NV2050. So now I'm going to hand this over to Carrie Ward, who's going to talk about our coordinated plan.
Thanks, Ben. So the main way that the main program in which we really center the needs of the aging population in the capital region is through our work with what we call for short the coordinated plan, but the full name is the Coordinated Public Transit Human Services Transportation Plan. So it looks at coordinating CDTA services and human services transportation being like senior vans or ARC transportation type of services. And I did want to note that this work is guided by the Regional Transportation Coordination Committee because that group is open to the public when we have in-person meetings, which we're not having right now. But the meetings are online and anyone can join, but they do need to register ahead of time for them. And you can do that by emailing me, and my email address is at the end of my section of the presentation. Next. So one of the things that we do in our coordinated plan, which we do about every 4 or 5 years, is to look at a number of different demographic categories of people in the capital region. And I pulled 2 of those, 2 maps and 1 table from our document here. This one on this slide is the population 65 and older. And this is what they call a dot density map. So on this map, 1 dot is 30 people age 65 or older. The dots are not in exact locations. They're just randomly placed within the census tracts. So the idea is that you look at it from a little bit of a distance, and it shows you just the concentration in the general locations where we find people age 65 and older. Next slide. And then this one is the map that we have for people who have a disability in the capital region. And this one with 1 dot is 50 people. So again, it shows, most, as with the general population, there's a stronger concentration in the cities and the more urban areas, but people who have a disability do live all throughout the capital region. Next. And then this slide looks at the poverty rate by age, and this is just by county. So green, the purple bars are people 65 years old and older. And you can see that actually that's people 65 and above have a lower poverty rate across the board in our region, although Saratoga County, the poverty rate for older adults is pretty similar to the other age groups, although Saratoga County does have a much lower poverty rate overall than the other 3 counties. Next slide. Okay, so in this, the last coordinated plan that we did, which was completed in 2019, included results of a survey that we did of seniors and also people who have a disability. It was actually the same exact survey, except that we put different titles on it. And we did that because we were pretty sure that there were a lot of seniors who, if they saw a survey that said that it was for seniors and people who have a disability, that they would think that it wasn't for them. And so we just made a separate one that said seniors, and and one that said for people who have a disability. In all, we had about 250 seniors who completed it and 56 people who had a disability, although you'll see that a lot of the seniors did also say that they have a disability, and some of the people who completed the disability survey were seniors. The map here shows the distribution of the responses that we got. We asked them for their zip code. So you can see we did get some out of our region. It was available online, so people just were forwarding it to each other. Next slide, Jen. Okay. So the next few slides, I threw in some graphs showing the results of the survey that we did of seniors, and then the one for people who have a disability. So you can see these are just, these aren't percentages, these are just numbers of people. Of the seniors, more of them replied that they do have access to a car at home, and you'll note that the whether they drive or whether they have a car at home is pretty closely aligned for the senior group. Where can't you go was actually a open-ended question. We asked if there was anywhere that you couldn't go on a regular basis, and if they said yes, then we asked them where they couldn't go. So once they wrote in their answers and we entered them, I then went through and tried to categorize them based on the type of thing that they were saying that they wanted to do, but they weren't able to do. So the most frequent one was actually doctor or medical appointments. And then the next one was shopping, then socializing, meetings and errands, church, recreation and entertainment, and then just people who said I can't go anywhere were other responses that we got. Next slide. Why can't you get there was another open-ended question. So again, I categorized these based on the kind of language that they were using, but the most frequent thing they said was that they didn't have a car, or that they didn't drive, or that it was too far for them to drive and they weren't comfortable. Saying that they couldn't walk or it was too difficult to walk was another common response, as well as no transportation nearby, which could be that the CDTA wasn't nearby, or that they weren't within the catchment area for the STAR service, or also that they happened to live in a town where there wasn't a senior service available. Or it could also be that they weren't educated about the options that were actually available to them. Transit or STAR being inefficient came up a number of times. Snow and weather, so that could be, you know, they are more mobile in the summertime than they are in the winter. And then also taxis or chancies, which is like Uber and Lyft, and the or transit were too expensive. Difficult issue seeing with eyesight, other medical issues, and then not knowing how to use the bus. A couple of people said. The multiple choice question was, how have you traveled in the last few weeks? So of the seniors, most of them said that, or the most frequent response was that they drove themselves. And then next to that, a friend or family drove them. And then only after that was it that they used some kind of a agency service. And then walking was also pretty frequent in CDTA, other, and a volunteer service, which could be like community caregivers or the CareLinks program out of Glenville, the two most likely sources of that. And then taxi and a few other options. Next slide. So you see here about half of people who answered the senior survey said that they did not have a disability, and then maybe well, a little less than half said yes, and then some of them said that they didn't want to tell us. And in terms of ages, it was mostly people 61 to 70, and then 71 to 80, with a good number also 81 to 90. Next slide. So for the survey that we titled People Who Have a Disability, I will note on this one, it was available online and we sent it out through social media as well. But I think most of the people who responded to this responded because we pulled a sample of CDTA's STAR customers who had actually requested a ride in the prior month to when we sent out the survey. So a number of people who were definitely STAR users filled out this survey. So driving and access to a car, the questions, do you drive and do you have access to a car at home, was a much higher proportion of who said no. And you'll also notice for this one that the numbers, whether you do drive and do have access to a car at home, there was a little bit more of a difference there, where some people said that they might drive, but they don't have a car at home. Where can't you go? Shopping and doctor medical were reversed from the senior survey. So shopping was most frequent. Doctor medical was still pretty frequent though, which is a little bit surprising since people who have a disability should be able to get disability transportation. But it could be that people feel like functionally they have a disability, but they don't have enough of a disability basically to qualify for Medicaid transportation. A number of people, and again, this was an open-ended question, were just kind of said that they kind of can't leave their house, so they can't go anywhere. And a number also said that they can't work or find a job, which relates back to the income category. And then socializing, recreation, entertainment, education or day hab programs, meetings and appointments, and church and hair came up a couple times. Next slide. Why can't you get there? Can't walk or difficult to walk came up most frequently. And then just transit and not, that they didn't live or their work or wherever they were going wasn't in the area of where CDTA operates. And that there's no accessible transportation, other medical issues, the expense of taxis and TNC or STAR, problems with eyesight, and then that STAR or transit that they felt that it was too inefficient. And then how they traveled in the last few weeks, the most frequent response was STAR, and then friend or family, and then walked the CDTA. Agency services. Some people did drive themselves, Lyft, Uber, and taxi, and a number of other responses. Next slide. And then for the age range, we had a pretty good range of ages who filled out this survey, but the most common ages were 21 to 30 and 61 to 70. Next. Okay, this is the only slide I have in here on this, but whenever we do the coordinated plan, we have included results of a provider survey. So that's agencies that provide human services, transportation, and including CDTA. And we ask them, kind of what about their practices and about needs that they perceive that they have. So this is a snapshot of the takeaways that we had from our most recent provider survey. We noted that respondents are willing to partner with other providers in a variety of ways. And that's an important question that we always ask because the federal transportation funding that is available for human services transportation requires partnerships or coordination among different providers. The use of volunteer drivers is increasing among respondents, which brings along with it a lot of questions about the best ways to find the volunteers and then also to keep them. In the next 5 years, over half of the respondents' vans and cars will need to be replaced. So they're looking at, collectively, we seem to be looking at a lot of financial output that's going to happen for replacing vans or potentially an inability to provide the same level of service as what they're currently providing. Providing trip planning or travel assistance by agencies seems to be increasing. So basically that means, you know, they don't provide a service themselves. They seek to understand who is providing what services and to inform their own customers or clients about the services that are otherwise available to them. And then also insurance costs seem to be increasing. That wasn't something that we confirmed, but there was a number of respondents who noted that as an issue. Next slide. So overall issues and opportunities from the coordinated plan, looking at demographics and the two surveys that we did. I think we're a little bit surprised at the frequency and the issues that people were having with walking in their communities. And so just increasing the accessibility of the existing pedestrian networks is an opportunity. Doing Americans with Disabilities Act transition plans, that's something that local municipalities should actually already have, but many of them have plans that don't include the pedestrian facilities, so sidewalks and the crosswalks and curb ramps and the push buttons on the poles for the pedestrian signals to cross intersections. So basically their plans that inventory the condition of the existing infrastructure and then lay out a year by year priority for what is expected to get fixed and when. Barriers to use of fixed route transit, which could be perceived barriers. So, you know, we've heard in the past that people may be uncomfortable being on vehicles with people who aren't like them, but it also could be accessibility issues, so they may not be able to physically walk, for example, to the transit stop. Regional development patterns, this refers to a tendency for health services and different kinds of locations where human service transportation providers need to go, getting more spread out. So that impacts the transportation provider's ability to provide service to as many people because each trip takes longer. And it can also impact the ability of people to get places on their own by walking. We had a good amount of confusion about the disposal and transfer rules of federally funded vehicles, so that agencies could, you know, once if they didn't need a federally funded vehicle anymore, how they could get that to an agency that might need it. Emergency preparedness for transportation disadvantaged populations, including seniors and people who have disabilities, seems to be an opportunity. There's, I think, a lot of concern on the part of providers of, you know, what would happen to their clients if there's a flood or some kind of emergency, because there would be a great difficulty communicating and figuring out the best ways to get people to where they need to go in an emergency. Loneliness and isolation was new this time and timely given COVID. This was actually finished before the COVID shutdown last year happened, but it's certainly more of an issue now than we thought that it was. There are a number of examples of mobility management efforts in New York State, mostly in more rural areas. And then, excuse me, we did put together a senior transportation guide in a partnership with the Albany Guardian Society. So I did want to just note that it's available on the Guardian Society's website. If you go to directories, the first one there is their housing directory, and then under that, I think, is the senior transportation directory. It is only available online right now because we were anticipating a number of changes with COVID, but we are still planning to print that this year. Next slide. And finally, I wanted to know the tools of the trade, which is normally a biennial workshop that we hold. We were supposed to hold it last year and we canceled it. And we decided just to hold it virtually this year. So we're planning it for April 1st in the time area of 9 a.m. to 1 p.m. And we have speakers to talk about isolation and health. We actually have a doctor who is affiliated with Albany Med coming to talk about that. We have 4 local organizations that use a lot of volunteer, either drivers or volunteers for other things, coming to talk about what they do for volunteer recruitment and retention, but it's going to be a little bit of a brainstorming session with the attendees. We'll have somebody from Ithaca. They had received a federal grant to do a mobility as a service project. And they actually were kind of in the middle of rolling that out when COVID happened. And so they were able to pivot it a little bit this past fall, looking at connecting people, actually transporting the people to the vaccine locations. And then CDTA staff will come to talk about their flex service, which is a little bit of a CDTA answer to the to the Uber and Lyft kind of service. So it's a CDTA provided service, but you request it on in an app on a cell phone, and it's like a demand response service. The area where it's currently provided is in the like Wolf Road airport area in Colony and out into Guilderland a little bit, but they are looking at potential expansion locations, so they'll be able to talk about that. And here's my email address. So the tools of the trade registration is required for that. You can contact me there. But also if you are interested in attending the Regional Transportation Coordination Committee meetings, that's how you should contact me and request to get added to the list. And I think that's my last slide.
That is. Thank you, Carrie. Next, we have Erin Mitchell, Director of Engagement for AARP New York. Erin, just let me know when you want the slides to go forward.
Okay, sure. Thank you, Jen. Next slide, please. So I'm the Director of Engagement at AARP New York, and we've worked on aging and mobility for many years. AARP has its AARP Livable website, as well as a lot of resources and guidance for folks, as we also have our network of age-friendly communities. So with that said, you can see here that Aging of America from 2015 to 2030 really almost doubled in size. You can see back in 2015, New York State was about 15% of the population was 65 plus. And now, well, in 2030, it'll be almost 23% of the population. Next slide. The 2020 census reported that the 65 and older population grew by over a third. That's 34.2% during the past decade. People over 65 years old will outnumber children by 2035, a first in the US history, according to an updated projections released by the Census Bureau. Next slide. And as of January 1st, 2030, boomers, Gen Xers, and millennials will all be age 50 or older. That's really, if you really think about that, 3 generations all over 50, that's going to be a lot of people to service. Next slide. So when we ask people, especially older adults, you know, where they'd like to live as they age, 8 in 10 people 50 plus expect to stay in their own community. And that's really interesting because we've heard Jen and Carrie go through the different surveys and what people are telling us that they want. And although they want to stay in their own community, many still don't have access to the transportation and mobility needs. Next slide. So an AARP Home and Community Preferences Survey found that most older adults drive themselves, 84%, 38% walk, and then have others drive or use public transportation. A few years ago, only 13% recorded riding a bike or use a ride share or taxi. Next slide. These can be roadblocks to age-friendly communities, lack of options for people who stop driving, public transit accessibility. You may or may not have access to public transit where you are. Overall, bike and pedestrian fatalities are increasing, and among those fatalities, older adults tend to be most of them. There's more older adults killed every year in pedestrian fatalities than children. Next slide. Not only do older adults want to stay in their community, they also want it to be walkable. Safe streets, as Jen and Carrie have mentioned, are the most important community features for older adults. In fact, 8 in 10 people 50 plus want streets and sidewalks that are safe and accessible. Now, one note on safe streets and complete streets. Back in 2010, AARP New York launched walk audits all throughout the capital region. And I believe Carrie and Jen were among those participating in our walk audits back then. And we were able to advocate after that for ordinances for local complete streets throughout the capital region, which then eventually led to the passage of the Complete Streets Law. That was signed by the governor later that year. Next slide. And on the topic of pedestrian safety for older adults, people aged 65 and older are 50% more likely than younger people to be struck and killed by a car while walking. And that goes back to a previous slide that we covered. Next slide. We do have new insights to share on 50 plus cyclists, especially in this time of the pandemic and COVID-19. It actually has motivated many older adults to start bicycling again or to ride more. Older bicyclists want access to high quality bike networks and fewer potential points of conflict with motorists. Older adults prefer to bicycle in places with easy, accessible places to shop, work, and socialize. And e-bikes are growing in popularity with use increasing with a rider's age. Now, to read more, you can go to the link that you see here, and it's our new AARP.org livable communities Getting Around Info 2020 50 plus cycling survey. Next slide. AARP in the last 3 years has been grant funding local work in the capital region across the state and nation through their community challenge grant projects. So far, we have helped to fund a community rail trail in Delmar that was enhanced with the art benches and pathway renovation to promote more walkability and bikeability in the community. In Bethlehem, AARP funded a project to install a mural along the Albany County Helderberg Hudson Rail Trail. And the grant was key in garnering additional community support for the county's Art on Rail Trail project. And then in Saratoga, the project installed a temporary two-way cycle track parking and wayfinding to make biking more accessible for residents and visitors of all ages and abilities. And down there at the bottom, you can see the website if you want to go and check out aarp.org/community challenge. You can do that down there. Next slide. And good news is that the 2021 application window opens February 17th for the 2021 Community Challenge grants. You can also use our new livable map that AARP has at aarp.org. Next slide. And then AARP, as I said in the beginning, has many resources available to advance mobility options. And so if you go to aarp.org/livable communities, you can find a bunch of resources to use in your local neighborhoods. Next slide. And we also empower residents to take action. We convene residents and communities, giving them tools to take action, advocating for local policy changes, and we deliver technical assistance as well. And then on the side of the slide, you can see our walk audit toolkit and our roadmap to livability that are also free to download from our website. Next slide. And then here is our AARP walk audit toolkit and leader guide. So if you are thinking about holding some walk audits in your own neighborhood or town, AARP makes it really simple for folks. Everything is right on our website. It's downloadable, and then you can go from there. Next slide. And thank you. Does anyone have any questions?
Thank you, Erin. So we'll have people, if they have questions, put them in the chat or the Q&A function, and then at the end, we'll go back to answering them if there are any. So you just got a lot of information about existing issues and some ways to resolve those issues, and then some things that initiatives that are moving forward in the capital region. If your community is interested in tackling some problems locally, you might be looking for some assistance or funding to do so. We always encourage our local governments to contact CDTC to talk about issues and to see if there are available resources. Right now, we are awaiting an announcement on the Section 5310 funds, the funding for accessible vehicles and other mobility management activities. Once we have information on that, we will definitely be promoting that program. The low, no emission vehicle program, which allows municipalities and transit agencies to purchase low and no emission vehicles, including accessible vehicles, was announced on Thursday that there's funding available. And then CDTC works with the Regional Planning Commission, where we support a technical assistance program. Currently that's not open, but we do encourage communities to reach out so we can talk about potential future opportunities or other ways we can help you. The next TIP or capital program is anticipated to happen in 2022. So that is something for communities to prepare for. And then, of course, there's always ongoing talk of stimulus right now, but we do not have any information on whether that will happen or what that will look like. So today's webinar will be uploaded to the CDTC YouTube channel. You can find it by going to YouTube and searching Capital District Transportation Committee. You can also find us on social media. You can visit our website at cdtcmpo.org. And here is our other contact information. Our office is mostly closed right now as staff is working remotely. So if you need to get in touch by phone, we have a virtual voicemail box that's set up where you can text or leave a voicemail and staff will get back to you. So that is the end of our slides. If you would like to ask a question, you can please put it in the chat or the Q&A. I would say, Erin, over last summer, not last summer, 2 summers ago, when Saratoga Springs did the cycle track demonstration, I visited and it was really great to see both of our organization's logos on the signs around the city. And from what I understand since then, Bike-A-Toga, their local bicycle group, has been hosting bike rides just for seniors regularly. And now they do what they call slow roll rides, where they invite people of all abilities to come bike with them once a week. And Bike-A-Toga has seen an increasing number of seniors participating.
That's really great news, Jen. I was really excited to see both of our organizations partnering together. And I will say I was really happy to see that some of the examples that you and Carrie used come right from those projects. So like I said, that AARP Community Challenge grants, they open tomorrow, February 17th.
Great. And Kat asked if, yes, Kat asked if our presentation was recorded, and we've recorded the whole presentation where we'll upload it to the YouTube channel, and I'd be happy to share the link with anyone, and we will post the link to the recorded webinar to the CDTC webpage. And Carrie, the tools of the trade training coming up, is registration right now to email you, or is there a link set up that we can post to the website soon?
There's no, there will be a link to register, but it's not ready yet. So the best way right now, I mean, if you're going to remember to recheck the website, that's a good method, but I would probably not do that. So that's why if you think you might be interested, email me and I'll add you to the list to notify when we announce that. I'm still working on making sure I know exactly who's presenting on the volunteer session.
We'll give people a couple of minutes to ask a question. So I don't think that we have any questions from attendees. So thank you so much, Erin, for joining us today and talking about AARP's initiatives today on our webinar. And Carrie, thank you also. And we hope you have a good afternoon.
Thank you.
Thanks, Jen.